This is Dr. Caroline Peterson with Natural Women's Health Institute in Sarasota, Florida. I'm talking to you today about vulvar varicosities. I've included the words perineum and labial because sometimes people will do searches um, for like a labial varicosity, but it's actually these perineum and labia are actually, part of the vulva. And so the big idea is vulvar varicosities. The vulva is, in short, the external female genitalia. So that's the mons pubis, which is that mound that will generally have hair on it in front of the pubic bone. The labia majora and minora, the clitoris, and vestibular bulbs, both of those are erectile tissue. The vestibular bulbs are kind of like the legs of the clitoris, so they're connected in an extension of the clitoris, kind of. And then the vulvar vestibule, which is kind of like the flat part when you open up the labia. And that includes the Bartlett's glands, which is just inside of the vaginal opening. Those are lubricating glands for the vagina. The Skene's glands, which are the lubricating glands for the urethra. The urethra, which is where the pee comes out. And then the vaginal introitus is, of course, the entryway of the vagina. So vulvar varicosities are enlarged veins between your legs in that area of the vulva. These can be painful or non-painful. They can be itchy. They can be heavy. They can have different symptoms, but they're basically on the outside of the pelvic floor, by the vagina, and between the vagina and the anus where the poop comes out. The symptoms that are associated basically with all varicosities, but yes, with vulvar varicosities, are a sense of fullness, pressure, pain, or itchiness in the region where you have the varicosities. This could be in the vulva, it could be in the upper thighs, it could be in the lower back, because where the veins get engorged and there's stasis or congestion, that is going to cause annoyance to the surrounding tissues. And so everybody's going to start complaining. And so we'll see by the drainage patterns why all these different areas are involved. With all kinds of varicosity, the discomfort is worse with standing. Why? Because the job of the veins is to bring blood up, up, up. And so if the veins are incompetent in any way, if they're having a challenge, a difficulty bringing up bringing up blood, then of course that's going to be challenged by standing. And then discomfort with these vulvar varicosities is worse with sex, because what is sex? Sex brings in blood, and then you got to get rid of it. And so if there is a problem with the venous system, you're going to have a problem getting rid of blood. And so you're going to be bringing in blood, and that's not going to have a way to get out of the pelvis very easily. And that will cause more engorgement, more discomfort. And then, of course, there can be a mechanical component with sex itself that causes pain to the engorged, veins themselves. But a lot of it is because the drainage is not happening after more blood comes in during sex. Vulvar varicosities are associated with other kinds of pelvic varicosities. So once the system starts getting blocked, you're going to see more and more blockage, because it's not draining further up somewhere. And so we got to find further up somewhere, where is that constriction? Where is that constraint? Where is it not draining? We got to figure that out. Of course, pregnant women are very likely to have vulvar varicosities because of the baby, because of the extra blood, because of the challenges that are placed on the body because of pregnancy itself. And then in the postpartum, many times these vulvar varicosities will continue. So two main reasons for vulvar varicosities, or really any kind of varicosity. Something's blocking the vein return, or the veins lose confidence themselves and the little valves inside the vein are not able to open and close very well. The walls of the vein are not strong enough to pull up the blood very well. So things that can block the blood return are congestion. That's fluid. So you're having a problem draining the fluid because there's too much fluid that's in the tissue out of the channels. And so we got to find out where is that congestion coming from, get all the fluid back in the channels, whether it's blood or lymph, get that rocking again. And so the main reasons for congestion can be either fascial constraint. Fascia is like the connective tissue, kind of like saran wrap. That's like a web that goes around everything in your body, throughout your whole entire body. And so you can have fascial constraint somewhere else that is like pulling on the pelvic region, creating constraint. So you got to be able to like read that fascia flow and move with it and go to the place of origin where that constraint is coming from. The other big reason is that there's some kind of a mass that's kind of laying on or blocking or decreasing the venous return. So that mass could be the uterus. It could be the uterus in pregnancy. It could be a retroverted uterus, or it could be some other organ like a sigmoid colon or kidney or something else, a cecum, that's in relationship with the drainage but not moving properly. And maybe it's not moving properly, when you're thinking about the intestines because of constipation, because there's too much fecal matter in there. That's kind of like nailing that part of the intestine into place. Could be because of fascial constraint. Fascial constraint can be because of inflammation, infection, prior surgeries, things like that, injuries, stuff like that can cause fascial constraint, which causes adhesions, which is, another word for adhesions, which is another word for scar tissue, right? So adhesions in the fascia is really like scar tissue. It says that area has been injured before and it needs help unwinding. Of course, other things are like tumors. So if you have, let's say if you have a cyst or a tumor, a fibroid, anything like that, a uterine fibroid, an ovarian cyst, could be, endometriosis, all of those things can cause congestion in the pelvis that leads to vulvar varicosities. So we have to know, what the underlying cause is, identify that so that we can make sure we take care of everything instead of just treating symptoms. And so, like I was mentioning, the other thing besides something blocking the blood return is that the veins themselves lose confidence in their walls and in the valves. So this is kind of like an overview of how the vulvar veins drain. And so the main drains are the internal and external pudendal veins that drain into the internal and external iliac veins. Now we're going to go a little bit into more detail. So looking here, we see the external iliac veins. They're the ones that go down into the legs and drain the legs and then part of the pelvis. And then the internal iliac veins, those are the ones that do most of the drainage out of the pelvis. They come into the common iliac veins on both sides, which then come into the inferior vena cava and takes the blood back up to the heart. So what we see in the vulva is that there's a lot of kind of mixed drainage patterns. So the redundancy, the body loves redundancy when there's something really important. And so we're going to see like a lot of anastomosis, a lot of alternative routes in the drainage system. And of course, it's not just important to drain the venous system, but also the lymphatic system, because that also, when the veins slow down, you're going to get leakage out into the lymphatic system. And then also when there's congestion, you're going to get enlargement of the lymph nodes. That's going to slow down the lymphatics. So you're going to see lymphatic involvement in almost all cases of varicosities or vulvar varicosities. So generally be a component. That also needs to be addressed. So remember, the internal pudendal veins drain into the internal iliac vein. And the internal pudendal veins get blood from the inferior rectal veins, the clitoral veins, the posterior labial veins, the penile and scrotal veins, the anus, urogenital diaphragm, perineum. That all goes internal, iliac vein. And then the external pudendal vein goes into external iliac vein, and that will drain clitoris, labia, penis, and scrotum. Then this external pudendal vein is the one that goes into the external iliac vein. But first, here's the deep pudendal and superficial pudendal going into the great saphenous vein. This is in the leg. And so that's why, with vulvar varicosities, a lot of times they'll get that heaviness in the upper thigh right here. And that's because this part is not draining right. So the great saphenous vein drains into the femoral vein, and that goes under this inguinal ligament. And that is where the hip hooks up into the pelvis. That's kind of like the crease when you sit down, where you bend, and that's like the crease between the leg and the belly. And so because there's a big, ligament that's going over the top of that femoral vein, this area, it can have more constraint. And also because we do a lot of sitting, so we tend to be pretty tight in this area. And so everything that's under that, or say inferior, further down the leg from that inguinal ligament or that crease in your leg, is going to have a tendency to get a bit squished. And then that femoral vein changes its name into that external iliac vein once it gets into the pelvis underneath of that inguinal ligament. So here's just another view. So here you see the inguinal ligament. Here's your leg, right? So this is the part we're getting a close up of. So there is the kind of like hole that everything has to go into from the leg to get into the pelvis. You can see there can be fascial constraint here. And there's the external pudendal veins, these two right here, that have to go into the saphenous, which goes into the femoral, which goes into that hole, which then goes into the external iliac vein here. It's just a little close up. So that external iliac vein, we talked about how it drains the lower extremity, the external genitalia, that comes from the external pudendal vein. It also drains the mons pubis. That's the mound of, it usually has hair, or sometimes has hair in the front of the pelvis, and also the inferior abdominal wall. So this external iliac vein is draining quite a bit. So I wanted to show this picture of that pubic vein. So it's actually related to the obturator vein. And so sometimes you'll see that here's the pubic vein that's draining into that external iliac vein, but it can also get backed up. If there's backup here on the external iliac vein, then it can back up into the obturator. And so like I was saying before, the body has redundancy. It has alternative routes, and this is one of them. So, because a lot of times you'll see people with lower extremity varicosities, pelvic varicosities, they'll have a very, very puffy pubic region, and they'll be like, why am I so puffy here? And it's because even though the pubic region is higher up, the thing that's being constrained or constricted is further down. So it's important to know about the drainage pattern so you can check the right areas to get optimal drainage. So we have these venous plexes that are really important too for draining. So the uterovaginal plexus right here is going to drain not only into the internal iliac vein, which then goes into the common iliac veins and the vena cava on both sides, it's also draining into the ovarian veins. And so this is super important because now we're seeing again how there's more involvement with structures that are higher up. So the left ovarian vein is like very commonly the cause of pelvic congestion. And that's because it has like a really kind of difficult route of going home because it can't just plug into the vena cava like the right ovarian vein. It has to go all the way up into the renal vein and then cross over. Of course, what's here? That's going to be the aorta, the whole artery blood supply going down. So this is kind of, it's not just like, hello, I'm just plugged in. It has, there's more possibility for things going wrong when you have to plug into the left renal vein, and then the left renal vein has to go across and plug into the vena cava. And so all I'm saying is that you gotta know the circulatory system so that you can get a better idea of what's involved and what's going on. You can't just look, oh, there's the vulva, let's just treat the vulva. No, you have to know how it's related to everything else and what to do about it. So when I see somebody with vulvar varicosities, then my main thing is to figure out, well, why? What is going on? So is there a mass that's blocking it somewhere? What is that mass? Is it a viscera? Is it an organ itself? Is it constipation? Is it fascia? Is it a tumor? Got to find out all that stuff. And so then we work with mobilizing the viscera, the organs, the vascular system, the lymphatic system. We do that through the belly, through the front and back of the body, and also inside of the body, inside of the vagina, inside of the anus. That's the intrapelvic drainage and fascial release care. And all of this is done in a certain order, in a certain way that responds to the needs of your bodies and your comfort level. So you're always in charge. The other thing is that we'll need to support the veins. So I like to use herbs for that, to help to rebuild the valves and the walls and to decrease inflammation. We want to make the blood slippery because whenever there's venous congestion, there's going to be more of a likelihood of clots, and we don't want that. And if you've already had a lot of congestion for a long time, then you may have clots. And so I like to use an enzyme to break those down. So like a nattokinase or a lumbrokinase to break down the blood clots and so they're not going to be dangerous. So of course, sometimes with vulvar varicosities, it's not uncommon to have hemorrhoids, and you may not even know you have hemorrhoids because a lot of hemorrhoids, especially internal hemorrhoids, are not painful. And so a lot of times, if I'm not getting the results that I want as quickly as I want, then I'll recommend just a round of homeopathic hemorrhoid suppositories. They're like $10 or something for a week supply. So it's super low cost. And, you can usually tell after doing a box of these if that's playing a role or not. So in pregnancy, people are usually pretty interested in getting the vulvar varicosities addressed. And so they're common during pregnancy because you got, about half as much more blood than you have when you're not pregnant. So you have this increased blood volume. You have the progesterone decreasing the vessel tone. So that leads to more stasis. And of course, you got a baby on board. And so that uterus itself is right in the area where everything is supposed to be draining. And so if you started out, if you had some, issue prior to pregnancy that was related to some kind of fascial constraint in that area, it's just going to be more pronounced during pregnancy. And so I like to use the Arvigo myoabdominal therapy to work with the uterus, mobilizing the uterus. I give exercises for strengthening the core so that we can have more stability of the uterus and more lift out of the pelvis. Sometimes people are too busy or they're too far along or, whatever, they're not interested in doing the exercises, not able to for some reason. And so for those folks, we'll do some kind of a belly band or some kind of a faja or a lift and of that belly off of the pelvis so that we can get better drainage. And so I'll do, this visceral and vascular manipulation of the belly and the pelvis. And then after 36 weeks, I'll do the intrapelvic work if the woman is, interested in that. For me, it's super, super important as a retired midwife because I observed sometimes that some of the difficulty in labor was actually caused by fluid retention in the pelvis. And so for me, if you can drain that pelvis and work on the fascial system, not only the fascial system, first you got to work on the fluid, the edema in there, get that all draining out. Then you can see what's going on with the muscles and the fascia and balance that out so that it sets people up for a more straightforward birth. And that's of course my commitment to women and birth. Um, trying to get trying to take care of as many things in advance so that the actual experience of labor and birth are as straightforward as they can be. This is Dr. Caroline Peterson from Sarasota, Florida, and Natural Women's Health Institute. Take a look at our website and come in today.